Hi, thank you so much for joining us. On this episode, we'll be speaking with Dr. Dahlia Dickman about the importance of having clean, hygienic scrubs for frontline healthcare workers. I'm Jeremy Ladner, and this is What's New. Dr. Dahlia Dickman, thank you so much for joining us on the show today.
Hi, Jeremy. Thank you for having me.
Absolute pleasure. All right, so let's start off with, what might be obvious to some. There's certainly some new norms in the world today. We are wearing masks. Many of us are wearing gloves. And for those of us who are maybe not aware, there is a vital importance for frontline healthcare workers, who we all have a new appreciation for them to have safe, clean, hygienic scrubs. Maybe you can tell us a little bit about some of the challenges that they face in their daily tasks on the front line, dealing with contagions and pathogens and all sorts of difficulties in keeping their clothes clean and safe.
Sure. As we know, textiles play an important role in the acquisition and transmission of pathogens in healthcare. So the workwear environment is obviously an environment that's likely to afford a good environment for pathogen growth. So much that the CDC, or the Center for Disease Control, has made recommendations as to how the uniforms should be laundered to ensure that these pathogens are killed and that they're away from the patients, they're away from the healthcare workers, and keeping everybody safe. So these recommendations are very specific in terms of how the uniforms should be laundered, and not easy to achieve, nearly impossible to achieve at home. So there's a specifically high temperature that needs to be used, and particular detergents that need to be used to make sure that all of the pathogens are eradicated. And at home, there's no way that any a regular washing machine can reach these temperatures. So interestingly, in the US, for example, the nurses' uniforms are not laundered in the hospital. They're required to take their uniforms home and launder them
I
at home.
gotta stop you right there. That is unbelievable to me. The idea that a nurse or a doctor or a surgeon or even the maintenance folks at the hospital, who are walking around through potentially dangerous areas, who are at some point in the day in their job may be covered in something, are expected to then take their clothes home, perhaps through public transit, exposing who knows to their family at home, to launder themselves. I was not aware of that. That is shocking to me, and quite honestly, a little bit scary.
Yeah.
Tell us more, please.
Yeah, Jeremy, that is very scary, and I think with the awareness now with the coronavirus outbreak, the nurses are really demanding that they have their uniforms laundered and managed in the hospitals. And in Europe, for example, this has already been adopted, so they manage all of the uniforms in the hospital, including the nurses. The U.S. unfortunately falls a little bit behind here, and I think they need to take some steps forward and adopt better solutions for managing the workwear. There's a lot of literature out there that actually discusses this problem. So this is professional literature that shows that in some cases 39% of nurses' uniforms that are laundered at home were contaminated with antibiotic resistant bacteria, for example. And by the end of the shift, 100% of the uniforms are going to be contaminated with some type of pathogen.
That is remarkable, and of course terrifying, and the whole idea of social distancing seems to be null and void if these garments are allowed to sort of be out in public. Certainly, it seems like Polytex has an interesting solution. So maybe you can tell us a little bit more about what Polytex brings to the market as far as helping prevent the transmission of pathogens through garments.
Sure. Polytex provides a very innovative full cycle solution for the management of healthcare uniforms. So from laundering to bringing it to the healthcare workers, and then collecting it and having it re-laundered. So if we want to take a look at the actual cycle, so there's a system that's loaded by the professional laundering service. No contact by anybody. They're individually wrapped and loaded into the system, at which time they're available for the healthcare workers to come in and grab their uniforms hands-free. I say grab, but it's hands-free. So the system identifies the user and is able to distribute automatically which uniform they need, what size they need, and at that time, hands-free again, they get their uniforms. And it also provides a solution for the inventory and the management of the uniforms, which is also critical for a hospital. These days, we need to be very conscious of those things as well. Once the uniforms have been used and contaminated, they're then loaded into a separate unit, which is collected by the professional laundering team and then laundered, and the cycle starts once again. So this is a perfect solution. Nobody needs to really deal with it. It's all managed very easily and very intuitively.
All right, great. So I just wanted to be clear here. So a little bit earlier, we discussed the idea of there being cards. So every healthcare employee's got their own card. They walk up to this machine at the beginning of their shift, swipe this card. They get the option there to select the garment sizes they need or whatever might be appropriate for what they're going to be doing that day. Off they go to do their work, come into contact with contagions. At the end of the day, swipe the card again, deposit it into a separate machine where then it's picked up for proper laundering, not taking it home. That's fantastic. That's great. What a fantastic solution.
Yeah. Let me add one more point here. So
Sure.
I had mentioned the recommendations by the CDC with regards to laundering, but it doesn't stop there. So the entire management of clean laundry is not less important. So there's a real danger of recontamination of clean laundry just by handling. So this is a perfect solution. It's hands-free. Nobody touches anybody else's workwear except for the person that's going to wear it. And it really makes sure that everything is done according to the recommendations by these government agencies.
Okay, great. And we're also taking a look on screen now at what the machines actually look like. Fantastic. Okay. Why don't we talk a little bit about the future? Obviously, we're at a point now where it looks like there's some daylight, there's some light at the end of the tunnel. We're coming out on the other end. Globally, many places are returning to the new normal. What do you think the future holds next winter, next pandemic, next wave, and how can Polytex play a role in helping?
Well, we already see that hospitals are actively adopting this solution. So there are thousands of hospitals that have already implemented the Polytex solution and are using it on a daily basis. Some of these are very prestigious hospitals in the US and in other places in the world. I believe that at one point we'll look back and we'll ask ourselves how it was ever done differently. I think this provides a very good solution for the management of healthcare uniforms. And now, especially in this crisis with the coronavirus and with these quarantine departments, it's becoming more and more popular to use this type of solution where you really have to because there's a quarantine. So I really see this as being an important part in the prevention also of another outbreak.
That sounds fantastic, and that certainly is good news. I'm sure there are a lot of healthcare workers who might be watching this thinking, wow, what a relief it would be to not have to have that potentially dangerous responsibility on their hands. Dahlia, thank you so much for joining us on the show. We really appreciate it.
My pleasure. Thank you for having me.
Pleasure. And thanks to all of you for watching. We certainly appreciate that as well. If you like the show, please let us know. Like, share, and subscribe. Don't forget to hit that bell so you get notified of all of our latest episodes. If you have any questions for Dahlia, leave them in the comment section down below. We'll be sure to make sure that she gets them. Until next time, I'm Jeremy Ladner, and this is What's New.